Everyone, welcome back to the channel. My name is Drew. I'm an accredited exercise physiologist, a Chinese medicine practitioner, practicing yoga, pranayama, qigong, tai chi for over 20 years. And I really specialize in just creating bespoke exercise rehabilitation programs for help people recover from accident, illness, and injury. And it's a blend of manual therapy using Chinese medicine, kind of neuroscience, our understanding of modern exercise rehabilitation techniques, and it's all just kind of combined together. So modern kind of knowledge and ancient wisdom. And today in our series, we're looking at some yoga postures, and we're going to looking at a classic one called the locust posture, or it's a back extension, so a spinal extension. So this is kind of how you train your back if you want to get a strong back. All right, this is basically the extension pattern. So we're going to be looking at that in a bit more detail. Today, we're using Muscle in Motion, the app. I'll leave the link down in the description to jump on there, get yourself a subscription. We're going to be looking at just a piece of the app here today. So definitely more for you to explore. And we're in the yoga app. So let's jump on over to the yoga app here. We're in asanas, we're in back bends, and if you click into asanas, you'll be able to find locust pose there. So you click onto asana, and you've got a heap of back bends here, and so we're looking at locust pose or salabhasana. Please forgive my horrible Sanskrit. All right, so you fire it up. Shake me out of the way a little bit. This is a web-based platform, so if your internet's kind of a bit slow or if it's busy, sometimes it can be a little bit clunky. Like I got super fast internet and I'm not quite sure why it's taking forever to load. Whereas before, when I just did my check-in before recording, of course, it loaded fine. So I don't know what's going on. Okay, so give it a second. Here it goes. Bang, we're back. Joys of using cloud-based tech. All right, so let's maximize the screen. So this is a really cool image to start off with. So we have the model here doing a really nice demonstration of a full spinal extension or back bend, or in yoga it's called locust pose. And then we have the anatomical model here kind of showing us which muscles are really active and which muscles are being stretched. So let's come back to the start here. The key movement factor is going to be all these muscles along the spine. See, and just pay attention to her shoulders here as well. So as she lifts up, chest lifts up, and the shoulders are away from the ears, which is really critical. So we're going to dig into that a little bit more. Okay. Nice back bend here. This is spinal extension. So we've got a big lordosis here. This is what we want. Glute max is going to contract. Hamstring is going to be active. There's some calf activity here, but majority of work is in this region through here, the lower back. Okay. So let's dig into that a little bit. So we'll go into the next image. This is a really cool diagram here. So we have this image showing a scapular retraction and scapular depression at the same time. So shoulder blades retract, so the shoulder blades come together. This is via the rhomboids in the middle trapezius. And then scapular depression is that you can see here that the whole shoulder blade will be then pulled down. So depending where you start, if you're a little bit more in a shrug position, okay, you can see the pivot point's roughly here. And so this inferior angle is being swung down back. So it gives you a sensation of your shoulder blade sliding down your spine, which is pretty cool. So when you start here, when you're in the start position, as you breathe in and lift up, you want to pull your shoulder blades down. So it's really a trapezius movement here. So your back muscles, the trapezius are a big part of your back. So you really want to make sure you're getting those bad boys engaged. Another angle here. The other way. So the pelvic muscles here from a different angle is the trapezius and the rhomboids. Okay, lifting up. And what you want to think about is when you are doing a back bend, okay, often it's on the inhalation. Now, the reason why you do it on the inhalation is that you're going to bring air into the lungs. And the more air you're trying to get into the lungs, the more space that you have to make. Okay. Now, because the ribs are on the ground, the ribs can't push down into the ground and the chest can't really like move forward too much. So to create that space, you have to lift the back up. Okay. So if you do that on the inhale, that'll help facilitate you getting more air in, which will give you more back bend or more lift. So typically in yoga, in classical yoga and like yoga therapy, back bends are done on the inhalation. And that's the main reason is you're trying to create space to move air into the lungs through here. You can try do it on the exhale, and you can definitely do it. It just doesn't feel right. It's kind of like going backwards, and your range of movement will be definitely restricted. And that's because you're not getting that air into the lungs. So I think it's like a balloon, and the balloon expands. At the same time, as you're filling the lungs up with air, they're expanding. That's creating pressure and creates stability in the thorax as well. So you're going to use that inhalation to create stability and pressure in the thorax. And then the muscles here are working to kind of create that lift. At the same time, the glute muscles are going to be contracting quite strongly, and the lumbar spine muscle is going to be contracting quite strongly. Okay, so here we just have a nice little diagram. So we have our spinal erectors, so this long group of muscles that go from basically the base of the skull, the occipital region, right down the spine, down to the sacrum. You've got your gluteus max, which is your big butt muscle, hamstrings, and soleus. So when you're contracting, these muscles are pulling down this way to lift the chest up, and the glute muscles, the hamstrings, and the calf are kind of pulling this way. So you get this kind of bow shape or back bend, and so your posterior chain will be active. Now, most of the work's going to be done in this region here in the lumbar spine. So here again, we can see, so you've got the splenius capitis muscle. You're going to be using all these extensors in the cervical region. And then you got spinalis thoracis, longissimus, and iliocostalis, those three long muscles that thread up the spine segmentally. And so they are quite a big group of muscles when you stack them all together. On top of that, you will have rhomboids here, middle trapezius, then lower trapezius, and then in the lower back here, you're going to have the quadratus lumborum on top of the erector spinae muscles. And then on top of all those, you're going to have the lat muscle come over the top, and then they'll have the thoracolumbar fascia that sits on top of that. So you've got these kind of multiple layers. So you're not going to be using your lats too much in this position because the arms are in full flexion, flexion. So which means the lats will be in a long position. But if you bring your arms on the side of the body, okay, into what's more classically called like a Superman posture, you'll definitely get lats on, you'll get more scap depression. So the arm position will change how the muscles are used in the exercise. So if we look at some of the preparatory muscles, this is a kind of cool. So here we have a classic kind of cobra position. So the yellow is the muscles are getting stretched. So the abdominal muscles on the front are getting stretched. And it's fine to stretch the abdominals. Any muscle that's too tight will cause restriction. Any muscles that's too long and doesn't have the strength to manage that length will cause issues as well. You'll lack stability. So always the goal is you want muscles that can contract through their full range of movement and then return back to the resting length. Okay, that's the goal. So in this position, this is going to be, depending how you do this, could be active or passive. So here you've got the pelvic floor muscles. You've got the inner unit, so that's most likely the transverse abdominis. So you can tell that by the fiber direction coming horizontally. And then you've got the latissimus dorsi here. That's the lat muscle we were just talking about. And then you can kind of see some of these kind of extensor muscles threading down the spine. So if you relax your back muscles, you can hold this position passively, meaning that you're resting on your shoulders and your forearms, and the muscles here can be relaxed. So what that means is then that the actual vertebrae joints will then they will sit down into their natural resting position without the muscles contracting them. Okay, so you'd call that a passive position. So you're not trying to engage the muscles at all. That can be good if you want to mobilize the joint, if you want to encourage the discs to get a little bit of compression into them, which can help drawing in nutrients into the disc. So that can be good for its healing, or just as general uptake. And you can also then get a sense of the kind of the health of the spine, because when you do a passive back bend like that, you're essentially bringing the ends of the vertebrae together, and you should be able to do that in pretty good position and not have any pain or discomfort. Okay, so if you're doing these passive back bends and you're fully relaxed there, and then you're just basically resting the lumbar vertebrae onto lumbar vertebrae, if there's irritation, if there's inflammation, if there's arthritis, there's something disky going on, because you're directly pushing down and compressing into it, that can be irritating, and that could potentially give you a bit of an indicator there's something not quite right, or you still need to be doing some other kind of work to resolve that back problem. Also, in terms of the disc in position, because it's in passive extension, so majority of people's disc injuries are from forward flexion, so too much kind of like sitting in a kind of forward flexed, hunched around a position. So this can kind of like put a counter pressure onto the disc. And for some people, it can be really relieving, quite relaxing, because you're taking the pressure off the front part of the disc here, and then you're putting it more into the posterior part there. Okay, so that space there is kind of getting closed, whereas when you go forward flex, this part gets wedged and everything gets pushed out that way. Whereas here, the disc is getting pushed down this way. So for most people who are flexion intolerant, meaning if they are in this position, because it's kind of encouraging the disc to kind of be pressed back this way, it can be quite relieving for folks. So it can be like a nice rest position or a relieving pop position. However, for some people, depending on what's going on in the structure, it can be really, really irritating. And if someone's got more of an anterior kind of disc bulge, it could be actually quite aggravating. So you need to kind of adjust accordingly. But this is a good preparatory pose where you are then preparing for back bend. Now you can also do this with active contraction. So on the exhalation, you can contract your pelvic floor, you can contract the lumbar extension, and you can try to lift the chest up a bit more using the musculature there as well. And you can move in from both. So you can kind of like inhale and relax, and then exhale, contract. All right. Or you can start low and inhale actively, then exhale actively as well. So there's a couple of different methods you can apply to that, depending on your goal. Now, if we look at this posture, this is often called an up dog. So resting on the toes. Let me put this up over here. Okay. Really nice back bend position. Where can I go? Maybe over here. Yeah, put this up over there. So we've got a nice back bend. You're resting on the toes. So a lot of the weight's coming down through the hip joint and right down into the lumbar segment. So, for example, if someone was really irritable in the passive cobra position where they're resting on the elbows, you wouldn't bring them up in this position, because this is a much stronger, a lot more weight coming down through here, a lot more torque, a lot more force. So it's going to be a lot more challenging to the structures in your lower back. So you wouldn't encourage this position. However, if someone can do the low cobra well and the locust position well, then they can absolutely start to develop this position. And one way you can do that is actually have the knees on the ground. So you keep your shins and knee on the ground, and then you just start to lift the thighs up. Now, one thing you'll see here, you can see this big tricep contraction here. Okay. All right. So what this lady has done here is she's using her upper body strength. So it's triceps. She's using her rhomboids through here to pull the shoulder blades back. And then as she opens up and lifts the chest on the inhale, okay, the shoulders roll back, and then a strong push down creates more space in here. So if we go back a little bit, yeah, and let's see her shoulders come back here. Perfect. That's exactly what you want. I'll just go back again to show it again. Here, and the shoulders retract back there. So in that, and when we're looking at before, we're looking at the rhomboids. That's what you want here. So what's holding her up here is triceps, but also those rhomboids, middle and lower traps. They're pulling the shoulder blades down. Now, it's a little bit counterintuitive. So to create that movement, what you need to do is push your hands into the floor, lift your chest up, pull your shoulder blades together and pull them down at the same time. So this whole region through the back is really, really active. So I'll go through here and you can see there. So here, all these muscles in the back are active. So you've got this kind of lower traps, middle traps, rhomboids, triceps, working super hard. That's the posterior deltoid there. We have the latissimus dorsi working super hard. And then we've also got the pelvic floor. Okay, so these muscles on the exhalation particularly want to be like contracting, quite engaged, quite strong. You can see here her eye gaze is looking up, so her neck's in full extension as well. You just want to be mindful here because you want to be resting right on this joint there. And again, if people have got any neck issues, that can compromise the kind of the blood supply coming out of the base of the neck there and the nerves coming out of there. So you get like a pinching and a jamming, and you'll know that's happening because you'll get a pretty gnarly headache. And it's pretty interesting because the center of gravity typically in the head is usually around where the ears are, and the center of gravity is kind of behind the spine. So the weight of the head's now tipping back. So this is going to put a lot of big stretch on these neck muscles in the front, and the sternocleidomastoid here will be one that's holding that head up. Now, if you haven't trained your SCM, if it's weak, you may not have enough strength to hold the weight of the head up there as well. So you'll need to pay attention to your sternocleidomastoid. How do you get that stronger? You do sit-ups. Sit-ups. Okay. It's a great demonstration. This is such a good app. And if you just come back there, talking about her head, see how she's tucked in here? Okay, so she's got this nice long spine, cervical spine, so she's protecting her neck. And when you tuck in like that, you engage that SCM, and you also start to engage the spinal extensors here in the back. So you have a really nice, strong, supportive neck. You just don't want to like dump back and then dump forward. It's an excellent demonstration. Okay. All right. Now let's move into the next one. Another great posture. So moving it up into boat pose, Dhanasana. So this is a combination of lower back strength and chest opening here. So often one of the restrictors of back extension is tight chest muscles. So as she lifts up there, the chest and the biceps going to get a really, really intense stretch. In fact, a lot of people struggle getting this posture because they're so tight in the chest, they can't bring their shoulder blades back into that nice retracted position. They basically get stuck here. So they may need to do some preparatory work to open up the front of the chest. But as you're doing that, once you get into position, again, you've really got two options. You can do this passively. So if you can hold on to your hands, okay, and then kind of lock the elbow like the model has here, you will get a nice passive stretch into the chest there. And you don't need to use your back muscles to hold that position as much. Essentially, you're just locking in and using the skeletal structure to maintain that position there. So you can get quite a deep stretch there and hold it. Your weight's going to be sitting on the ribs typically. So for some people, that means they can't breathe as comfortably just because the weight is kind of down at the base where the diaphragm is. So you may not be able to breathe in as deeply as you can. So typically when you're in really big back bends, because the abdominals are on full stretch and the ribs are in like a lifted flat position, the diaphragm doesn't have a lot of room to dome down, so you can't take in these big breaths, particularly when you're up at the top end range. So you like taking more like smaller kind of sips of air when you're up there. Second kind of option is to be really active. So you can kind of be focusing on squeezing your butt muscles, squeezing your lower back muscles, squeezing those shoulder blade muscles to help you stay in the lift. And then the third level here is then you can add in some penile stretching where you're going to push your foot away. So you're going to try to create knee extension. And that's going to then tension this stretch here and give you more of a deeper chest bicep stretch and abdominal stretch. You're also going to get a big rectus femoris stretch here. So a big hip flexor stretch. So a lot of people nowadays are very tight in the hip flexors. And this is also another limiting factor to getting into this posture. So in kind of the yoga practice, we often would refer to it as a peak posture. So you need to kind of prepare the body before you get into this position. So you would do shoulder openers, you would do back bends, you would do kind of hip openers before you go into this. So in my typical kind of class that I teach, when I do my back series, so when I'm doing my locust or my back extension series, I usually do it in 3 rounds. I do a really gentle kind of low level round where we're focusing on more just posture alignment and breathing and using the breath to create the natural extension movement. And then we slowly kind of ink. And then the second round is more of a intermediate kind of level where we change hand positions, we change the lever position of the arms and the legs. So it's slightly more difficult to do. Then the third level, we're usually taking the arms out into full extension or full flexion. So we're getting the longest levers. And then I will typically finish if I'm adding in a kind of quad chest opener sequence into bow pose last, and with options to do single leg versions as well. So I would never like throw someone into this posture straight away because it's just too strong. And like if you've got super flexy bendy people, a good friend, a good yoga teacher friend of mine, like can just jump in this pose without even warming up. It's like she's just super bendy, flexible. That's just her natural kind of body, which is fine. But for most folks, you need to do some preparatory work for that. Okay, so just be mindful of that one. And yeah, we'll just finish up on this one here. Doing a nice Swiss ball spinal extension and using the dowel kind of in the back. This gives you some resistance to push against here and come all the way up. So here the spinal muscles are extending and then segmental extension come up here. So you've got a nice spine. Notice the chin tuck there. Okay. And then as she comes up into the lower back, and then going to use the glutes to hinge back up when she comes up next. You'll see that happen. So flat back here, all spinal extensors, and then hinging up through the butt muscle there. So this is a great preparatory movement to get into such like a forward fold. I love this exercise. Don't necessarily need a Swiss ball. You could do it on a chair or a bench. Just notice how the hips are a little bit higher than the knees. That just helps with the leverage. Good. You're going to get a beautiful stretch through the spine here. So this is a great exercise. Another little trick you can do here is you can kind of change the position of the dowel a couple segments up and a couple segments down. And then as you're lifting up and pushing the dowel, that's going to encourage you to activate those different segments of the spine as well. So that will help with spinal mobility, but also segmental spinal strength, which is fantastic. Just watch this person come up. Now, if you're going to come up from this position, the cue you want to do here is drive into the heel, focus on using your butt muscle, lift the chest up. So you're going to use your lower back and your glutes, hamstrings out all at the same time. And you do that on the inhalation. So you breathe in as you come up. So here, as you fold forward, you're going to breathe out. So that's going to encourage all the air to leave the lungs. And then when she comes up, inhale, chin tucked, long neck, nice long spine, and hinge through here. So this is a great way you can help teach people start to do hinge work, like deadlifting type kind of exercises, and get them connected to their spine where they're not as loaded. They're seated, so they're more stable, and the stick gives them feedback into the shape of their spine. It's actually a really cool exercise to do. Well, anyway, so we might leave it there. Coming back to our locust pose, finishing up here. Full spinal extension, using from the base of the skull right down to the Achilles tendon. Right, all these posterior muscles are all used. Here we're also getting some deltoid work here, trap work, butt work, glute work, lumbar spine. Now, if you've got a back problem, the way to treat a back problem is to strengthen your back. All right, this is basically physics, right? So if these muscles aren't strong enough to resist gravity, which is the force pulling you down this way, these muscles have to have a certain amount of strength to overcome gravity. If they can't do that, then you're going to be in trouble. Then you're not going to be able to use your access your muscles properly. It's going to put more loading into the stress into the joints, into tissues, into the ligaments, and that's often what creates mechanical back pain. So we want to get out of that. We don't want that. So this is a really, really good exercise to teach. Now, I'll have to go into the literature and check what the actual kind of forces that are going through the body here. I mean, some people kind of pew yoga and Pilates thinking like there's not enough loading, not enough force coming through. But when you're doing full bodyweight calisthenics training like this properly, you can develop a lot of strength. I mean, just look at gymnastics training, like pretty amazing athletes. So you don't need a specialist equipment. Your body is your gym. You just need to know how to do the right thing. Okay. So hopefully that was helpful, good and insightful little video. If you have any questions, please feel free to drop them down into the comments. Love getting comments and questions from you guys. And we'll keep looking at a few more of these yoga postures. They're great exercises to learn from. If you're doing Pilates, we just call this a supine back extension. If you're in the gym, it's a back extension. Like it's all the same stuff. It's just, you know, where you learn it from and the different kind of methods that people apply to it. But essentially, we're all doing the same thing. Okay. So wherever you are, keep training, keep studying, keep learning, and we'll see you on the next video. Ciao.